Heart disease is still the leading cause of death in the United States. And here's the part many families don't realize. About 1 in 5 heart attacks are silent, meaning the damage happens, but the person may not notice clear warning signs at the time. If you're over 70 or you love someone who is, these quiet changes can be the difference between catching a problem early and missing it. After 70, heart-related symptoms can look normal, like slowing down, getting tired, or feeling a little short of breath. Some people also don't get the classic chest pain they expect, so they wait and blame aging, stress, or indigestion instead. In this video, you'll learn 5 subtle, easy-to-miss signs that can point to heart disease, plus what to watch for and when to call for help. Quick note for adult children watching. You may spot changes before your parent does, like fewer outings, more resting, or "I'm fine" becoming the default answer. Consider using your phone to jot down dates, symptoms, and what was happening at the time, so you can share a clear story with the doctor. Sign number 1 is unusual fatigue that doesn't match your day. This isn't "I did a lot today" tired. It's a drained, heavy exhaustion from small tasks like showering, dressing, or walking to the mailbox. Mayo Clinic notes that when the heart can't pump enough blood to meet the body's needs, people can feel extreme fatigue during activities. After 70, it's easy to chalk that up to age, poor sleep, or just being out of shape. But persistent, unexplained fatigue can be a real signal to investigate. What to watch for this week? Fatigue that is new, worsening, or out of proportion to what you did. Notice if it comes with other small changes, needing more breaks, stopping mid-task, or avoiding stairs you used to handle. Also pay attention if fatigue comes with sweating, nausea, or a generally off feeling, even without chest pain. What to do? Bring it up at your next appointment, especially if it's been going on for more than a couple of weeks or is getting worse. If fatigue suddenly arrives with shortness of breath, fainting, or chest pressure, treat it as urgent and call 911. Sign number 2 is shortness of breath that seems small but keeps showing up. Mayo Clinic lists shortness of breath as a symptom seen in coronary artery disease and other heart conditions. It can feel like you can't catch your breath, or like you need extra pauses while talking, walking, or doing light chores. Here's why this can be a quiet heart clue. When the heart struggles to deliver oxygen-rich blood effectively, the body may respond with breathlessness, even without pain. And in some conditions, shortness of breath can happen during activity, at rest, or even wake someone up at night. What to watch for? Breathlessness that's new, happens with less effort than before, or appears along with unusual tiredness. Also watch for position clues, like needing more pillows, feeling worse lying flat, or waking up short of breath. What to do? Don't train through it without checking in. Make a medical appointment and describe exactly when it happens and what triggers it. If shortness of breath is sudden, severe, or comes with chest discomfort, dizziness, or fainting, call 911 right away. Sign number 3 is swelling in the feet, ankles, or legs, especially if it's new or steadily increasing. Mayo Clinic includes swollen legs, ankles, or feet among symptoms seen as some heart conditions worsen, such as cardiomyopathy, and also notes swelling with certain valve problems. This swelling can look like socks leaving deeper marks, shoes feeling tighter by afternoon, or puffy ankles that weren't there a month ago. What's happening? When the heart isn't pumping efficiently, fluid can back up and collect in the lower body. This isn't always dramatic. Sometimes it's subtle, and it creeps in slowly enough that it feels normal. What to watch for? Swelling that is one-sided, quickly worsening, or paired with shortness of breath, fatigue, or rapid weight changes. A helpful habit is to check ankles at the same time each day for a week, morning versus evening, and note any trend. What to do? Schedule a checkup and mention the pattern, not just "my ankles swell sometimes." If swelling comes with trouble breathing, chest pain, or fainting, that's urgent. Call 911. Sign number 4 is dizziness, lightheadedness, or feeling like you might faint, especially if it's repeated. Mayo Clinic lists dizziness, lightheadedness, and fainting or almost fainting among symptoms linked to certain heart rhythm problems and cardiomyopathy. Sometimes it's described as "the room shifts," "I get woozy when I stand," or "I need to grab the counter for a second." One possible reason, if the heart rhythm is too fast, too slow, or irregular, the brain may briefly get less blood flow, causing those spells. Mayo Clinic notes arrhythmias can come with racing heartbeat, slow heartbeat, fluttering, lightheadedness, and shortness of breath. What to watch for? Episodes that happen more than once, show up with palpitations, or occur during mild activity like walking to the kitchen. Also pay attention to near fainting in the bathroom, after standing up, or when climbing stairs. These details help a clinician evaluate what's going on. What to do? Don't brush off repeated dizziness as "just getting older," because it can increase fall risk and can signal a treatable heart issue. Write down what you felt, how long it lasted, and whether you noticed a racing or fluttering heartbeat. If someone actually faints, has chest pain, or has severe shortness of breath, call 911. Sign number 5 is odd discomfort, especially in the jaw, neck, back, or upper belly, plus nausea or indigestion that feels unusual for you. Mayo Clinic lists pain spreading to the neck, jaw, or back, and symptoms like heartburn and nausea among possible heart attack symptoms. And the American Heart Association notes that symptoms can vary, and women may have additional symptoms like shortness of breath, nausea or vomiting, and unusual tiredness and weakness. This is where many seniors get misled because upper belly discomfort can feel like acid reflux, a pulled muscle, or something I ate. But if discomfort is pressure-like, comes with sweating or breathlessness, or appears with unusual fatigue, it's safer to treat it seriously. What to watch for? Discomfort that is new, unexplained, or triggered by exertion, like walking, carrying groceries, or climbing stairs, then eases with rest. Also watch for nausea, cold sweats, or a sudden "I don't feel right" sensation, even if there's no dramatic chest pain. What to do? If symptoms seem like they could be heart-related and they come on suddenly or feel intense, call 911. Don't drive yourself. If it's milder but recurring, book a medical visit and describe the location, timing, triggers, and any companion symptoms like breathlessness or fatigue. To recap, the 5 quiet signs to respect after 70 are unusual fatigue, new shortness of breath, swelling in the lower body, repeated dizziness or near fainting, and unusual discomfort in places like the jaw, back, or upper belly, especially with nausea or sweating. If any of these are new, worsening, or happening together, schedule a checkup and bring notes, because heart disease is often easier to treat when found early. And if you suspect a heart attack or a medical emergency, such as chest pain, severe shortness of breath, or fainting, call 911 immediately, as Mayo Clinic advises seeking emergency help for these symptoms. Medical disclaimer: this video is for general education only and is not medical advice, diagnosis, or treatment. Always talk with a qualified healthcare professional about symptoms, medications, and personal risk, and call 911 for urgent or life-threatening symptoms.